At Mission Brain, we usually explore the complexity of neurons, blood vessels, and neurological syndromes. But today we want to step away from our textbook and talk something about far more ordinary, a simple fall, a sudden fall in the elderly. Something that seems minor, yet carries potential to becoming life-threatening within hours. Namaste, I'm Sumana, a medical student who is captivated by the beauty and complexity of human brain.
Namaste, I'm Rupashna, dedicated to bridging the gap between clinical science and the human brain.
And I am Ritika, drawn to the quiet warning signs of the brain and the careful judgment that timely neurosurgical intervention demands. Today, through Neuronotes and in collaboration with Neem Academy, we bring you a case that highlights the fragility of our elders and the thin line between a sudden fall and a neurosurgical emergency.
In our previous Neuronote, we discussed the devastating finality of irreversible bleeds. But today, we shift our focus to a different type of time is brain scenario, the one where the window of opportunity was narrow but still open. The patient was a 79-year-old female who had been living a quiet life until a simple slip in the bathroom changed everything. She struck her head against the bathroom floor. There was bleeding from her head, yet she was responding well initial hours after the fall. There was no nausea, no vomiting, and no bleeding from nose or ear. The family was divided whether to take her to the hospital or not. After noting that she seemed okay, they decided on the latter. But as the hours ticked by, the family noticed that something was off. She was drowsy and did not respond when called upon. She was then rushed to the ER immediately.
By the time she reached our emergency department, she was drowsy and confused, not oriented to time, place, and person. Her GCS was 9/15. She had a 4 cm lacerated wound over her right parieto-temporal scalp. An urgent CT scan revealed an acute epidural hematoma on the right frontotemporal-parietal region. The classic lens hyperdensity was pressing against her brain, causing a significant midline shift and needed urgent action. The surgical team acted swiftly, taking her to the operating theatre for a borehole and evacuation of the hematoma under general anesthesia. Through observing the borehole procedure for hematoma evacuation, I learned how much precision is required to do that procedure. The drilling through has to be very controlled, and a slightest error can damage the brain tissue. I learned that there needs to be precision in every movement and constant awareness throughout, because errors in neurosurgery aren't actually that forgiving.
The post-operative phase of this patient presented a significant clinical turning point. Prior to the acute event, the patient was able to perform her daily activities without any assistant. But after this incident, her motor power was significantly reduced. That was 2/5 on her left leg and 3/5 on her right leg. And it was a reminder that if the signs were not recognized early and the lucid period was not skipped, there might be complications which could easily be treated. Currently, it is going to require collaborative efforts between physiotherapy, caregivers, and a constant support from family members to restore her fully functional state. As medical students and aspiring neurosurgeons, this case offered us an insightful lesson that any presenting head trauma must be evaluated well to rule out any internal bleeds, and to make sure that there is no such incidents, we have to consider hospital visits just to be sure of it.
We often discuss about the lucid interval in epidural hemorrhages. In the elderly, this is even more treacherous. Presence of cerebral atrophy may also result in delayed presentation of altered consciousness following traumatic brain injury, as a greater volume of blood is required to exert pressure effects upon the brain parenchyma. This means that a hematoma can grow significantly before it starts pushing back. We learned that simply no vomiting or no headache in an elderly patient after a fall is not a green light. By the time she started feeling dizzy or drowsy, the internal bleed had spread much wider. It taught us that in geriatric population, we must treat every fall with the highest suspicion, regardless of how fine they may seem initially.
Seeing her power drop to 2/5 showed us that a frontoparietal bleed can compromise the motor homunculus, especially the areas that control the lower limbs, underscoring the value of basic neuroanatomy. The midline shift was compressing the cortical regions that allow her to stand, walk to the bathroom, climb stairs, and perform simple tasks like getting out of bed on her own, coupled with a deceptive lucid interval where she briefly seemed better before worsening. We were reminded how silent yet dangerous such bleeds can be. we realized that saving a life in neurosurgery is often about saving a lifestyle, preserving her independence in dressing, bathing, and moving around her home. Saving a life is not just about keeping her heart beating, but about recognizing signs early and intervening so she can return to the small everyday actions that make her life hers.
Most importantly, this case taught us about humility. Even with a successful surgical management, recovery of motor power is not guaranteed. We learned that a win in OR is just one of the many steps of recovery. Complete recovery is a very long marathon involving physiotherapy and intensive nursing care. After such injury, patient often becomes partially or completely dependent on the family members for the daily care. The family plays a crucial role in post-stroke care, including assistance with mobilization, ambulization, feeding, hygiene, and physiotherapy. Recovery after a hematoma is quite gradual, and both the patient and the family require time to cope up with physical deficits, speech impairment, and emotional changes. The loss of independence places a significant physical, emotional, and financial burden in the family as well. So caregivers might experience stress, fatigue, and anxiety while adapting to the increasing responsibility and role changes. Hence, family education, psychosocial support, and rehabilitative services are essential to reduce caregiver burden and to improve long-term outcomes for both the patient as well as the family. This case helps us understand the meaning of success, as it is not just successful surgery, but also the return of patients' normal functioning and restoring their quality of life.
This case was a powerful reminder that many families may not recognize the significance of a lucid interval during which the patient seems normal or improved. This false sense of recovery can lead to a delayed medical attention and loss of crucial time. In this case, the family initially felt reassured by the patient's temporary improvement, only to face sudden deterioration and profound grief later. Witnessing this progression reinforced the importance of understanding the cerebrovascular pathology, as timely intervention and recognition of the symptoms can be life-saving.
Thank you for joining us on Neuronotes. We are very grateful to Rima Academy for allowing us to bridge the gap between medicine and human spirits. Remember, a fall is never just a fall, and in neurology, even the smallest of the details matter.